A quick casual intro because these videos are going to be much shorter and more casual. They'll be just a few minutes chatting about AI and AI in healthcare. I'm actually holding the camera for these videos, so you'll probably see it moving around. This is an attempt to try to stop myself from recording any long videos or rambling on too long, because I just wanted these to be really short snippets with bite-sized information to learn about AI. So I use AI every single day. I use it for personal use. I use it for work as a software engineer. I've also developed AI tools, and I have even used it for medical purposes as well, especially trying to learn and understand specific terms. So that is going to be the main focus of what these videos are. I will hop on here occasionally and just make these really short bite-sized videos to share something, maybe a way that I might be using AI, an edge case that I think is really important to know about, or things that I have learned along the way that I think could be helpful for others to know. I've noticed that the adoption of AI has happened pretty rapidly, and there's very few people teaching us about all of the edge cases. There was an article, for example, that came out about people using LLMs for therapy. There have been articles on both sides of that showing the positives where people really feel like they got a lot out of it, and then there have been other ones that show that has caused kind of vulnerable populations to spiral. And I think the path of which route you end up down for those can be really hard to spot when you are having these conversations with these large language models. So I think it's really important to share both the very powerful uses and some of the most practical and handy ways that you can use these tools, but also share some of the edge cases, especially things like ChatGPT, where if you put your information in, they can't delete it. Even if you delete it, they have to keep those records. I don't think a lot of people know that. And when you're putting information into an LLM, it's very different than just like a Google search. I think people have known for years that you can put things into a Google search and they can use those to target ads, for example. But LLMs are a little bit different. You probably need to think about data safety 10x when it comes to using LLMs. Because even if you delete a conversation or history, it is learning. Even if you turn it off, as far as training data, it is still learning about you, and it still can remember things. And I think eventually down the road, this will probably end up having a few more safety consequences. So it's something to really think about and keep in mind. Every model is a little bit different, and it can be really hard to keep up with. This is something that I follow on the bleeding edge of. So I will try to pass along any tips I learn along the way, help share bite-sized new updates and summaries, and we'll keep this pretty high level, but I also want to make sure that people learn about the best way to use these tools, not only safely, but the way to be most productive with them. But feel free to drop in the comments which of these LLMs you use most often. Do you use Grok? Do you use Claude? Do you use Perplexity? ChatGPT? So many different providers. So feel free to drop in the comments what you use most often, and feel free to share any use cases or scenarios. I might talk about some of those on here, as well as if you have any questions that you would like to see me cover, feel free to drop those in the comments as well, and I can pick from some of those topics and share from the perspective and experiences of how I've used the platforms. All right, we are keeping this short, and I am going to wrap this up here.